Does scoliosis need to be treated by someone who focuses on scoliosis? Scoliosis is a very complex condition. It is highly variable and no two cases are the same. Scoliosis can affect all ages, ranges widely in severity, and there are different types a person can develop. The complex nature of the condition necessitates a complete customization of effective treatment plans in order to get adequate results with a patient with scoliosis. In addition, scoliosis is a progressive condition, meaning it is in very nature to worsen over time. With progressive conditions, when you actually start the treatment can be just as important as the type of treatment that you choose to use. In addition, with progressive conditions, where a patient's scoliosis is at the time of diagnosis may not be indicated where it may stay, meaning it may worsen over time. And we know scoliosis ranges widely in severity from mild to moderate to severe to very severe. And this is why scoliosis is a progressive condition. Being proactive with treatment is the key to slowing down or stopping progression and really in preventing any type of limitations as a result of scoliosis may lead to. There are many different ways to treat scoliosis. And even though we know scoliosis is progressive, it is highly treatable. As scoliosis is incurable, treatment is about how to best manage a scoliosis, which will be a lifelong condition. Treatment can involve traditional types of approaches that normally wait for curves to worsen and try to maybe consider surgery after it worsens, or more conservative non-surgical approaches that can try to manage the size of the curvature and reduce the curve before it becomes severe. How you diagnose scoliosis and respond to it is the key because it will shape the spine's long-term health and function. What I'd like to point out is that scoliosis is very complex, and it's beyond just general use of therapy or exercises or chiropractic care that can really manage a scoliosis appropriately. The scoliosis requires very specific scoliosis treatment to be crafted by somebody who focuses on scoliosis and tries to combine a multimodal approach in managing and reducing a scoliosis, especially on the conservative side. Now, when we look at general care for scoliosis, what could it include? General practitioners can screen for scoliosis and kind of treat people with scoliosis, but that's not the same as treating the scoliosis itself. And what I'm trying to say is patients with scoliosis may experience pain, may experience discomfort, may have symptoms of their scoliosis. And normally they can seek treatment from chiropractic care, from physical therapists, from pain injections or medications. And a lot of these things could be treating the symptoms that are associated with the scoliosis. However, the scoliosis itself is still staying the same size. However, it requires somebody who focuses on scoliosis, that uses scoliosis impacting therapy and exercises and chiropractic to actually reduce the scoliosis on a structural level. This is what we mean by correcting scoliosis. It's proactively trying to reduce the scoliosis size, not just trying to treat the symptoms that are associated with the scoliosis, and really addressing the scoliosis on a structural level. Now, when we look at somebody that has scoliosis, how would somebody who focuses on scoliosis treat that person? Conservative non-surgical approaches of scoliosis will address the scoliosis specifically, and this involves really trying to treat the scoliosis as close to the time of diagnosis as possible, because we kind of know that these curves tend to worsen over time, so we want to treat the curvature when it's at its smallest and most responsive, because a smaller curve will always respond better than a larger curve. A person that focuses on scoliosis as well will normally use a multimodal approach and integrate many different types of therapies and treatments to customize the program based upon many condition variables that the patient presents with. And we know that these types of approaches are combined to try to reduce the curvature at the structural level. Now, when we look at surgical treatment, this involves spinal fusion. And spinal fusion is a very costly, invasive, risky procedure. And spinal fusion can reduce the size of curvature by fusing it together by using rods and screws and attaching these rods and screws to the spine while bone grafts take place to try to fuse the spine together. And this spinal fusion typically occurs wherever the scoliosis is located and can include a large number of vertebrae. It can in fact be up to 10 to 11 different bones that are being fused together into one solid bone. So the reduction in the scoliosis is done at an expense, which is spinal flexibility and motion. And this loss of function of the spine is considered worth it to try to stop the curve from worsening. Few spines can also impact the very strength of the spine, can become more prone to injury, can lose spinal flexibility, can lead to pain and malfunction at the area of the scoliosis fusion. And of course, if this fails, it typically means multiple surgeries over somebody's lifetime, where conservative treatment offers a more natural, non-invasive approach that tries to reduce the size of curvature using specific types of chiropractic care, physical therapy, corrective bracing, and rehabilitation. However, the way the care is combined in a structural level has to be performed by somebody who really focuses on scoliosis. Now, as somebody who focuses on scoliosis, I know scoliosis and how it progresses, and I know the risk factors associated with it, and I've been trained using many different types of treatments, including Clear Scoliosis Institute certification, including my World Master certification from ISICO, my Advanced CIAS certification, my Scoli Brace certification, my Advanced Chiropractic Biophysics certification, my Digital Motion X-ray, Gomez Orthotics. So we use many different types of treatments to try to put together the most customized, integrative program to really treat someone's scoliosis, not the symptoms of their scoliosis. So here at the center, we combine all these scoliosis-specific treatments in one clinic to provide the very best options for our patients. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.